Hello, my name is Deja, and today I'll be discussing how the social determinants of health influence asthma, specifically focusing on reducing emergency room visits as the clinical outcome. I'll be using the Kaiser Family Foundation model, which includes 6 major determinants, and I also reference 3 recent peer-reviewed studies that highlight how these factors shape asthma control. Asthma is a chronic inflammatory disease that makes airways overly sensitive and causes coughing, wheezing, and difficulty breathing. For this assignment, the clinical outcome I chose is the reduction of emergency room visits, because ER visits tells us that asthma is not being controlled well or that something in the environment or social conditions is preventing good management. So the first determinant is economic stability, which means incomes affects whether someone can consistently afford controller inhalers, attend follow-up appointments, or live in a stable housing. Grant and colleagues found that financial strain leads to medication rationing and inconsistent management, which raises the likelihood of emergency room visits. When patients can't afford daily asthma care, they end up relying on crisis care. Education, access, and health literacy also play a major role. People with lower literacy may not understand their triggers, may use their inhalers incorrectly, or may not recognize early warning signs. Koumpagioti et al. Emphasized that lack of asthma education leads to poor symptom control, especially in children, which results in more ER visits. When asthma management instructions aren't understood, emergencies become more common. Healthcare access is another critical determinant. Without insurance, transportation, or regular providers, many people rely on the emergency department as their main source of asthma care. Without consistent follow-ups or preventative treatment, symptoms build up until they become emergencies. Neighborhood and built environment is one of the strongest determinants. Poor quality housing often includes mold, dust, pests, or tobacco smoke, all of which trigger asthma. Outdoor pollution from highways or industrial areas are also increases symptoms. Geiger and colleagues found that communities with higher social vulnerability had significantly more asthma-related emergency events, showing just how powerful the environment influences ER use. Social and community context includes things like supported home, exposure to smoking, and the overall stress level in someone's life. Stress increases inflammation, and secondhand smoke exposures make asthma significantly worse. When people have less support and more stress, they're more likely to experience severe flare-ups that leads to more ER visits. The food environment impacts asthma by influencing inflammation. Communities with limited access to nutritious foods rely more on processed inflammatory foods. This doesn't cause asthma, but it is increasing the baseline inflammation level in the body, making symptoms harder to control and flourish more likely. There are several ways to address these determinants. We can improve economic stability by connecting patients to medication assistance programs. We can support safer housing by advocating for repairs for mold, pests, and ventilation issues. Providing simple inhaler technique education improves health literacy. Increasing telehealth visits, expanding access to primary care, and offering school-based asthma management programs can also reduce ER visits. These changes don't fix everything, but research shows they directly improve asthma control. In summary, each social determinant, whether it's economic stability, education, healthcare access, neighborhood environment, social context, and food environment, plays a direct role in asthma control. Studies consistently show that negative determinants lead to an increase in emergency room visits, while addressing even 1 or 2 areas can significantly improve asthma outcomes. And finally, my references are listed here. Thank you for taking the time and listening. Have a great day.